30.
Oh.
Alright. So I tell the patient, I'm just gonna take some numbers, read out some numbers. You'll hear 1, 2, or 3, those are healthy gum. Anything higher, 4 or 5 is a sign of gum disease. And then I'll just read out the numbers. And Brittany will start entering that in. So at this point, David, I'm reading out the numbers. The assistant know which one.
Yeah.
You don't have to tell me what's next.
Okay.
You don't have to tell me the tooth number next. I'm just gonna read it along,
Okay.
right? And then just read out 4 sets of numbers. 3, 3, 3, and then lingual, distal lingual here. All right, 4, 3, 5. It's number 14. If let's say they're missing a tooth, then I'll read out to them. Oh, I'm measuring 18. Mesial buccal 18 or something. But if it's a standard 3, 14, 19, and 30, then I'll just continue to read the numbers. Yeah,
So it's typically 3, 14, 19, and 30.
that's right.
It's a 3 buckle, and then 14 lingual, and then 19 buckle, and 30 lingual.
Yep. You catch that? So the way the reading goes, it goes this way, and it wraps around, right? And it drops down here, and it goes here. So if I read 19, I'm gonna read the mesial first, mesial buccal first. So it starts right here. And then I'm gonna read 30, it starts from mesial lingual, and it goes here. And if let's say you're not sure on that, just write down all the numbers.
Yeah.
Yeah, just the 4 sets of numbers.
Yeah. I usually do it right here on the corner.
Okay, good. All right. So now we start to, so I'll let the patient know. So I'll explain in more details of what these numbers mean so that they're at ease. They're not like, oh, what does it mean, right? How does I have gum disease or not? And if I have to stop and explain, then we're kind of, we're losing our routine, right? So I tell them, I'll explain to you in more details in a little bit. Right, so now we're reading out number 2, decay, go across all the way to 32, right? And then when she record all that, then I'll turn around and just check. So we're okay to do prophy, or we do an SRP type 1. We can do 1 quad today. And then I might say, oh, this upper left area is next priority. But typically, right at this point, we don't solidify the priority just yet. I'll have an idea in mind, and then after I explain to the patient, per our discussion, then I'll repeat to the patient, okay, so this is what we're gonna do next. Like have their agreement, then Juana will take notes of that, and that will be the final priority.
But I thought at the time when you're explaining to the patient, Juana's actually in front typing up the treatment plan. So no. So typically she reads out all the treatment to me. I already know if they need a SRP, we automatically gonna start with SRP.
Okay.
And then she'll
But
from
the other
there,
ones?
the other one she'll give it to me after
Like,
she's done
okay.
with the patient.
She
So-
leaves when it's time for me to take pictures, help doctor pictures,
Yeah.
then she leaves the room.
Yeah.
Exactly, yeah, exactly. So right now, remember how we talked about, we already know what the time we have to work on this patient today. So if the chief complaint is a filling or something, I already told her, okay, I'm gonna do this filling today, or I'm gonna do 1 quad today. And then, even with that completed exam, even if she goes to the front, only because we're gonna be doing some treatment, so she wanna get that ready. And you have about a few minutes to take the photos. So Brittany will help take the photo. And the way I do the photos is, I have a piece of gauze. Thank you. So I would dry their teeth, let's say, let's see here. So I would hold a piece of gauze, dry their teeth, and then also Brittany will come over with the air and syringe too. And the same thing when we do the exam, huh, Brittany?
Yeah, I think I need to go over to how to actually take the photos. I don't know if
Yeah, and actually it would be good because I don't know if you guys. I know you guys start from the upper right, but then.
Sure.
Oh, I meant like the program, like
Can
can
you
you
grab
turn
me
it on?
the type it on?
Oh yeah, that too.
I have to turn it on, because it's different now. Like the
Oh, it is.
Actually, we should have David as a patient. David, I'll borrow you as a patient then. I'll borrow you as a patient. You have good teeth.
I have
Yeah.
a suggestion because we got about 30 minutes.
Yeah.
I think we come back to this, but maybe we go to the whole process first.
I see. Okay, good
Yeah.
suggestion. Yeah, thanks for keeping up with the time. So basically, roll back a little bit during the exam. Brittany held low air, so it'll go faster, and then she moved to the next X-ray. Yeah. And then now we're done, we take the photos. So we're just gonna show our front team how to take photos first. Yeah. So let's say blow some air. And you wanna wait until I focus it, I say go ahead, yeah. So, do you remember how to get to this screen?
I'm not really used to the other way, but she said there's a new way.
I don't
Yeah,
know
this
what
is the new way.
I don't know what to do, you know, so I can just go real fast.
They used to do the little point.
Through the camera here now?
Yeah, so
Oh,
we
okay.
go through the camera, you click right here,
Okay, so we don't have to go take
and then you have to make sure it's on the tooth,
off. Okay.
and then you go right here,
Okay.
and it comes up.
Yeah. So then snapshots, a bunch of snapshots, right? Right, bunch of snapshots. And then you have to get 4 images.
Once it does that, you have to click auto number, and then it's done.
And then leave this camera on. Even while I'm showing, don't take the camera away, because it freezes the software, right? So leave the camera on and connect it, even when we sit the patient up. Okay. So then as soon as we're done, we bring the screen over, take off your gloves, sit the patient chair up. All right, thank you so much. I got a chance to check all your teeth and we took some photo. Is it okay to show you what's going on? Patient said, okay, I don't mind. Some patients don't want to see their photos. And so now, this is the part we should talk about too. Yeah. This clipboard, how many do we have
I have that.
Mhm.
I'm not too sure, Doc. I have to
Yeah, I think we should
get more of those.
get more of these. That way you can use this mouse as you're sitting up close, because if you sit behind them, you show them that, you kind of talk behind there, they don't, you kind of miss their facial reaction to certain things that you say, right? So I prefer to move up this way more. And then I'm just right here, and I'm able to show, so this is what's going on, this is next, and I'm also looking at them, just to see. Sometimes they just zone out, and I know that they don't understand. Then I have to ask them questions. Oh, what do you think? You know, have you noticed that before? Have you noticed your gum bleeding before? Right? Because if we so focus on going through our whole routine and forget to observe them, then they just miss the whole thing. And that's another reason why by this time, Juana will come over on this side. Right? And now our assistant is pretty much done, right? But you also want to be around to...
We're in the back writing the...
Awesome! Great
the
job!
info.
Great job, exactly. Entering their memos and notes, exactly. And then I would say, oh, you met Juana. She'll be taking some notes on my recommendation. Okay, she'll be taking some notes for your treatment. And so they'll know, they'll already be like, why is she standing here? Right? So I have to introduce, oh, you met Juana, she'll taking some notes, right? And then we go over this. And then Juana will help also observe the patient, observe their reaction as well, and taking some notes. Because sometimes I'm busy talking, I might miss something. And Juana say, you know, Doc, when you were talking about that one crown, he shook his head, or he just like rolled his eyes. That means he's not buying it, right? So those are the clues that we as a team want to help pick up from the patient. So
Can,
now,
So this is the most important thing right here. So I want to be clear. If the okay, we do a lot of advertising, we send a lot of mailings out, and so it's very important for us to answer the phone because it could be a new patient at any given time. This is the only exception where we don't answer the phone, where it's important that we be in the room. And why? From a business point of view, you have a ready, willing, and able buyer here, right? You want to be in the room to serve them versus you answer the phone with someone that you don't know what's going on. And so it's very crucial. And the second part I think is very crucial is this is a team that we put together, right? And so it's going to take time for us to refine the process, make sure that we follow it correctly. And so every time we're done with a patient, we do a debrief, you know, to talk, and the doctor says, hey, why not, I prefer you do this a little bit. We have to follow the protocol, obviously, but there are things that we observe from one another that we want to give each other feedback. And so we're going to do that for the next 10, 20, even 30 patients. You know, regroup, hey, how did I do? Did they understand me?
I have a question. Let's say I was a new patient, I came, and then pretty bad, so you decided to do one quad group training. But the patient is expecting me to just have a cleaning done. So is that explained? Because there will be co-payment issue and every other thing. How will that communication be?
We're going to walk through those scenarios.
Oh, okay.
Okay, good. And so when you hear patient needs to be clean, that model is up and ready, right? And then I put this back like that, and then I go over, explain this. And then we were discussing with the doctor earlier about, as part of our explanation, we'll pre-answer any questions they might have. You might ask yourself, can I just get regular cleaning instead? And then the doctor will say, well, it's not beneficial for you. So the doctor will help not only educate, but remove a lot of the objections already, right? And so any questions, any feedback, and they're ready to do it. Okay, since you're here already, we can take care of one area of your mouth. You know, I don't say one quadrant because I don't know what quadrant is, right? So we'll take care of one area of your mouth, and then that's all. The next visit you come back, we take care of the rest, right? And then if let's say their treatment, the rest of the treatment is not, and as I say, after deep cleaning, then let's say you need this root canal, right? Then I'll explain that a little bit, but I don't spend too much time. I want them to focus on agreeing to the deep cleaning today, right? And I would say, well, Hana is going to get you an insurance estimate. Before I wait until they say, is insurance going to cover for it? I say, Hana is going to get you an estimate. We're transparent. We give you an estimate before we do any treatment. So a lot of times they feel relieved, like, oh, okay, I get to know then.
Okay.
Yeah.
Yeah, that's wonderful.
Yeah. And by saying Hana's going to give you an estimate, that implies there is a copay with this procedure, right? Right. So, and then also if they react to that, like, oh, do my insurance doesn't cover for all this? I would say, well, insurance will cover a majority of it, but this is a treatment that you need, so there's a small copayment on your part, right? But it's needed for your gum, something like that, right? And Hana will come right in. So the time that we were taking photos, Juan already entered in that.
Yeah, so I go to the front and enter the treatment. Or usually if they're one of this ops is available, I just use one of those and enter the treatment, get the estimate ready for the gum treatment, because if a doctor already said gum treatment, then we're gonna start with one area, and typically overall it's just the lower right we start with all the time. Lower right.
Lower right.
Yeah. So that's the area we start, and so I'll have that estimate ready for the patient. So while I'm here and she mentions it, I already have it with me.
Yeah. So I said, Juana's going to go over your estimate right now. She just flow right in. Right? And by this time, our assistant's already done entering the patient note, and they're kind of listening in. Are we setting up for that procedure? It could be a filling, it could be a root canal, it could be deep cleaning, right? And then, so now let's say the patient accepted, right? And then they're okay with the finance too? How do you let the team know?
So I go ahead and let David or Brittany know. We'll go ahead and start or just tell me go for it. And then I go and tell the doctor and say we're gonna go ahead and start the treatment, and then I come back and just let them know, well, doctor will be right with you and our clinical coordinator will be right with you as well.
Yeah.
And then usually if like they're busy, we always want to offer them like a movie while they're waiting. So that way they're not just sitting here by themselves. So I try my best.
Okay, that part, once again, communication. This patient is scheduled 20 minutes with the doctor for the exam, and then she's scheduled 30 minutes with the hygienist to do the cleaning. So if we're going to do the deep cleaning, then who's going to be the next person to get the baton? Is it the
Okay.
hygienist?
So why don't we do two scenarios first? Let's do the first one where the doctors do, there's no
Gotcha.
hygiene today.
Mm-hmm.
Right. I think this is so key.
Okay.
And the reason because we only have 35, 40 minutes, right, to do one card. So every minute counts now.
Okay.
Because we didn't anticipate for this. So one scenario happened last week was this. We presented and the patient say, oh, I didn't plan for this. So I think my wife's waiting for me at Target. Remember that picture?
Yeah.
So I'll just do a different day. Right? So I'm like, all right, no problem. So he walked out to the front and he called his wife. And his wife didn't answer. And I was here, so I told him, your wife went to Target. I told her that when we're ready, we're going to call her. So I said, all right, might as well do it. So, all right, change your plan. So bring him back. Relay, right? Clock is ticking. Clock is ticking. This is what I love. He comes in and we'll get started. So I saw Dr. Chow, you already working on the other patient. Now, two things happening, right? We're losing time. We don't want to change his mind. We don't want his phone to ring, his wife saying, honey, I'm here.
Yeah. We did it.
And this is all good for the patient, right?
Yeah,
You're not,
yeah,
it's
yeah,
effective for them.
definitely.
Don't waste their time.
Yes.
So I ran into David. He's back there. And I said, hey, David, this is what's going on, remember? And I said, can you go in and put topical gel and turn on the movie right away? Because that way he knows that it's committed.
Yeah.
He's starting. And you were very cool about it. Like, all right, let's do it. Right? You drop everything, came in, lean back, topical gel. By that time you're done, you came over and knocked the patient.
Yeah. So it takes everybody's alertness of where we're at and quickly responding to any changes.
Yeah, and I think there's time the doctors to be on the standby right here.
Mhm.
And surgeons want to say, okay, you can numb the patient right away too.
Mhm.
I
Yeah.
remember I even took his credit card when he was sitting here. I was like, you're not going anywhere.
In
one,
here?
one quick thing,
Sorry.
then. When we present, we don't collect the copay, right?
Yeah.
Because it's kind of weird.
Yeah,
you know?
yeah.
Only is the end of the day. If it's the last patient, and we do deep cleaning, because we want to close the end of the day, we don't want to wait for him to come out and he's numb and all that. So you can process the copay, but tell them the truth. To say, you can pay on your way out, but since you're our last patient, we're going to close the day, and want to make sure that you're on your way out, you have to wait for me, so let me process that for you. And you get the card and keep it out there. Get everything ready, no need to bring it back for him to sign.
Yeah, definitely.
Yeah, because that cut into the clinical time.
Yes.
So in here, we have, may I see the drawer? So topical, so we just grab that right away. Let's say the assistant is running to the back to set up. So you can just grab this and put it on right away. And then here too, we have, you just grab one of each and we have this is not loose, so you should have a loose syringe here. There you go. Okay, we should have that. So we grab this right away. You don't need to wait for the whole cassette to come out. You would just hook it up quickly and inject, right? Yeah, any procedure. Anything that you need to numb them, just grab that, do right away, because they're gonna take some time to open up the cassette and everything. Yeah, a lot faster. Okay, so now we got that process going.
And if it's hygienist.
And if it's a hygienist, may I see the clipboard? Where's the route sheet? Okay. So now remember this clipboard, I'm using it to write stuff on here. This route sheet is a new patient. We have information up here. The assistant already wrote some, doctor wrote some notes. We want to leave this here for the hygienist, right? And the front, only take the green sheet to enter information, because when the hygienist comes in, they're gonna need to refer to this, right? We should talk about who should notify the hygienist.
So normally the doctor, because you want to hand off the relationship, And that's standard for us. Whoever the last time saw the patient will introduce the other team member. You know? And so, John, this is Cheryl, hygienist. She's very nice and gentle. And we do that the same for assistants as well. Let's say the assistant, David, is helping you, and at the end of the procedure, the patient says, hey, can I do a night guard today? Take impression for it. And he has to go with you to the next patient, and you want Brittany to do it, right? So David will introduce Brittany too. Otherwise, Brittany's like, wow, I'm here. Okay, where are you? Where have you been all this time? So David will be, hey, so we're done. So this is Brittany, one of our my colleagues, help take impression for you. And then you go.
Yes,
Yeah.
I think that's the key. If you do need to switch, do tell the patient, I'm gonna have David switch in and take care of you. This is David, so the patient feel at ease, and we don't just quietly switch and then they're like, who's this new face, right? Sometimes if the assistant forget, then I'll say, oh, this is my assistant, David, he'll help me take care of you. But you guys should do that transfer, all right? So in the case, let's say doctor has to run to the next patient, hygienist is still with the patient, then it will be the assistant to notify the hygienist. So your patient's ready over there. So when they come in, they'll read this note and they'll greet the patient. Yeah. So front team, very important to leave this here. Sometimes we forget we take the whole clipboard. Just get the green sheet. Yeah, just take the green sheet only, okay? Yep. And then by the time the hygienist finished, the treatment plan already entered there, so they kind of know what's next, right? And mention it to the patient. Okay.
So just to confirm, so actually it's either the front person who will be putting the treatment plan, so and it's like writing down what treatment they need. But what about the existing, how the doctor when they examine the existing, do we have to write those too as well, or how does that
So
work?
we don't, that's a great question. We don't, because while we examine the patient, the doctor only calls out the teeth that need treatment,
Okay.
right? Let's say they have a bunch of crowns, but only one crown that has open margin. Then doctor will say, number 4, existing crown with open margin,
Okay.
and then replace the crown.
Okay.
So you just enter that only. You don't need to enter
Wonderful.
everything else.
Because that would save so much time because A, we know it's existing and then it's replacement. B, we know it's a new crown. So as a front person, that's already explained. So it's so much easier to get that data.
That's right.
Yeah.
Yeah.
Okay. Very good.
Good. All right. Yeah, that's the point she made is very good. That's why it's important to mention the existing of that tooth, not the rest of everything, but why that tooth needs treatment. You read out existing crown with open margin, and then replace crown, so that sometimes they need to check history. If can we replace it?
And also for the new crown, I think it's important for us to know whether it is due to the cavity or it's too worn down because the insurance will not cover the worn down crown. So sometimes that it gives us a head start to say, okay, the insurance will not cover for the crown. So,
Yeah. Basically, doctor only needs to tell you the reason why.
got it. Yeah,
For that
and
treatment.
that would be so much easier. Yes.
Yes. Instead of leaving this blanket to say, oh, number 5 needs a crown, and they don't know why it needs it. Okay. Good. So now the hygienist comes in and finish up. Our hygienist will walk the patient out and hand over to the same person that doing the exam with, right? And if let's say you're doctor, you're the one finishing up the treatment, prophy or whatnot, 5 minutes before that you start explaining about the next appointment, and you walk them out, you hand them to that person, right? If let's say Juana's on the phone, you let them, make yourself comfortable in the lobby, Juana's gonna be right with you, and you leave them that clipboard right in front of Juana, and they've already been communicated. Or if you didn't get a chance to finalize with them, then you want to write down next visit, NV, NB, right? This is a new patient, so there's no treatment plan in here. You can say fills upper right, right? And you already know how much time that you need. You can put 7 units. And that's all you need. You leave the chart there, want to get off the phone quickly, she's going to talk to the patient.
So I think it's back in November, December. We have an issue at Thomas Road where we have so many new patients came in, and we noticed that we did one quad, they came back for the other 3, but they don't schedule for treatment. And we got together, we troubleshooted, and realized why. What happens when a doctor did one quad, and we walk the patient out, and we focus on scheduling the other 3, and by that time, patients are tired. Right, and they're not even clear what's going on. And so we tweak the process a little bit. So if you do one quad, at the end, we say very clearly, okay, so John, so what I did today was on the one low right, you're gonna come back to see your hygienist, you're gonna finish the other 3 sides, and then you have another appointment with me to come back to carry your fillings.
Yeah.
So when you leave today, make sure that Wanda reserved 2 different appointments, one with a hygienist, and then one with me. So you 2 separate appointments. So I'll schedule you for the other 3 with Cheryl, and then Dr. Chow mentioned that you need to come back for the other filling. I'm scheduled that for you. Patient tell you, I don't want to do that. I just want to do the dip cleaning for now. What do you tell me? Okay. Wanda, what do you tell me?
I'm sorry, I didn't hear.
If the patient comes out and says, no, I only want to do the 3 quads, and when I come back, I schedule with the filling later.
I always like to just tell them, well, we can go ahead and just set up something tentatively, and we can always reschedule you if it doesn't work, the time doesn't work for you. But we try to put them on the book, set them on the book.
So the verbiage
don't-
would say, we want to make sure you have 2 appointments, one with our hygienist, the other one with Dr. Chow. And the benefit to schedule now is you're going to get the time that's most convenient for you. And so I want to make sure that you have it on the schedule.
And also, that will be available, you know, for the, I have one question. After they do the deep cleaning, how long do we usually, the next appointment?
We actually have an issue with that, we studied that too. But I think the main point is you can really help us, because patients get really confused. You know, there are times patients say, I thought I'm done. And you're like, no, you got a bunch of fillings. Oh, but what was that for? I did something that day, and then I came back for another hour and a half. I thought I'm all done. So you can be very clear, you know. And so today I did 1 quad. You come out, Cheryl. Now that's separate. That's for you to come. Okay. I need to see you back for your fillings. Right. So 2 different type of quads. Right. Okay. So the patient asks you, you know, I don't know my schedule and things. So when should I come back for the other 3 quads? Can I wait in between? I mean, what is the suggestion?
You want to come back within 7 days because the infection can spread from
It's on there, right? Yeah.
So she was said within 7 days.
within a week.
Wonderful. And then what about the fillings?
But within a week, but you have to explain the reason why, not just a week.
Okay.
That's because infection from the the space that we haven't cleaned will be traveling to the cleaned area.
Gotcha. That's great. That's a good.
How's our schedule? Do we have availability to come back within 1 week though? In case some patient really took that literally and said, you guys don't have availability for me, you know? Should we say 1 to 2 weeks? That way it gives us some leeway.
I think for now, but once we open hygiene days more, and I think if we put a specific number of days, it holds an account in their mind versus like,
Okay.
you know.
7
But
to
for
8.
now, because we don't have
Oh,
someone
for example, it had happened before. Let's say that there's the hygienist booked up, there's no space. Then could we just do it through the doctors to finish the 3 quad, or is it the hygienist that should be scheduled?
Oh, I see your question. Like here? Okay.
So the priority is the doctor do treatment first.
Okay.
But if it's last minute, you know, the day before, then you can fit.
Yeah, the day before. Let's say the day before, not her. His availability.
Because I seen it just looking at the schedule. There's sometimes that for 2 weeks the hygienist is all booked up.
Yeah.
So then by 2 weeks the patient already whatever he heard is gone. So me as a patient after 2 weeks I don't want to come back.
You're right, but also the thing is, hygiene schedule changes dynamically too, a
That's
lot of
true.
time. Like right now, next Monday, wide open on hygiene.
Gotcha.
So there's, we wanna have these patients be used to being, seeing hygienists, instead of, or else they're gonna keep, I want a doctor to do my clean, I
Yeah,
want a
that's
doctor to
true.
do
That's
this.
true.
You stuff like
And
that.
then also I think as me being uni, when I go to check this, code, I even check on the day what would be the next, just as an idea. So I'll be alert to schedule right away for that appointment.
Yeah. I think the time that, let's say some patient might say, oh yeah, I don't mind doing all my fillings and deep cleaning all together. And we talk with the doctor, and it's okay to schedule that. That way it's one visit. Yeah. But if we have hygiene available, we just quick with hygiene. Yeah.
So like if you have opening and you do the deep cleaning on the octagon, but if you don't, then the patient insists on it because the verb is saying you come back to Cheryl and they say, well, can I just see you? Because you did it today. And so let's say you're scheduled fully, but you need to get him off of you, right? And so the verb would be, so our hygienists actually train on focusing on gum treatment. And more importantly, after this, you need to come back every 3 months. And so it's called a payroll maintenance program. And so she's gonna take over and maintain it, monitor for you, right? And then I'll do the exam for you when you come in. So it's important that you have that relationship with a hygienist so that she can monitor your progress. Yeah, and we find it works really well. Because once they get into it and you agree, they stick with you for a long time. We still have some patients now that say, I want to do cleaning with Dr. Fan, which is great. We appreciate it, but when your schedule's full, you don't want to sit there and do deep cleaning.
Tim, also I checked on the ER, and then, we provide with the pre-med, peri-med, and then peri-deck. So it's the doctor who's going to recommend that, right? So what's usually, how is that done? Do we automatically cut it? Because I've seen some notes that say that, they felt like it was selling, but as long as we explain that it's necessary, it's part of the treatment, it's almost like getting an antibiotic. So how does the doctor help us to?
That's part of the explanation too.
Gotcha.
Yeah, part of the explanation. I think we can add that part in. I think
That's also.
is that also in there? It is in there, right? Okay, good. Yeah, that's part of our.
But in general, any over-the-counter stuff, we gotta hear because it's convenient for the patient. So if they don't want it, no problem. We're not really making any money off of it or anything like that.
Yeah.
And if they ask you for prescription, tell them.
Where the order in
Prescription for what?
Patient would be cheap trying to do that
Yeah.
there, and then you gotta run around, get a prescription, you go there, can't find it. It's
No,
just-
actually, it kind of killed me that just because of that, one person really put a 1 star. I know it will always happen, but as a front desk, if we are sure what's going on, then I think it's easier to.
So then we don't do the prescription anymore.
I mean, we do have it, but it's just too much. Remember we have a lot of this issue with those patients.
Yeah.
the
that's true.
is it the peri-med, right?
Yeah.
Okay.
Okay.
I haven't run across any issue. I mean, usually when we enter the treatment for the gum treatment, automatic peri-med and the oral, the other one,
Periodex.
Periodex, it's automatically in there already. It's set up to do a multi-coat, so it gets in there together. So I've never really had. The only issue that I've seen it come across is if it's like a couple, and they're like, well, can't we just share the rents? And if they're like really giving us a hard time, then I just say, okay, just be aware that, you have to follow the same procedure. It's not going to be enough for you. So, but I've never come across.
All right, so we'll do the handoff real quick then. So we want consistency. We call ourselves patient concierge. Like you go to the hotel, resort, and have one person take care of the beginning to the end. And so this is a case where you walk the patient out. Let's say you do some treatment the same day. When you walk out, you have to decide who you're going to hand the patient off right away. Like a few steps before you get there, because you're still being watched, right? You're on stage. This is part of building the confidence. Right? And so it will be the same person who presented, but if the person on the phone, then you can walk up to, let's say, Juana, and then hand out that way.
Should we introduce a new person now, or should just have one person continue?
Preferably have them wait
Yeah,
for the same person.
yeah, that way they have a whole treatment plan ready, they know exactly they were in the room. Yeah, I find that more effective versus you hand to a new person, you have to explain a lot more. I mean, there are cases, let's say this patient, let's say, oh, I have to go to lunch or something. You know, we align the lunch around that too, right?
Yeah.
But let's say for something that you know patient can't wait, and then when you hand off to a new person, you just gotta clearly
Yeah.
communicate and introduce, oh, Yumi will take care of you.
Yeah, so like if like the doctor said, we do plan, but our lunches are planned where like if there's a certain patient that I know the history of what's going on, and it's preferably that I stay there and check him in and check him out, and then we try to plan that thing for any other
Yeah, I think
patient.
that's very important. It's like going to a restaurant. You want to make sure that you get the same person serving you.
Yeah, okay.
We have a few situations where like you hand off to the front team and the patient will just ask you some questions, you know, and then sometimes they bring up some COVID issue, things like that. So there's some tips that we recommend so that it's a nice and clean handoff. And then you're done. You just go back here, continue what you're doing. And one thing that you can do that is the last 10 minutes when the patient is still in the chair, as you're finishing up, that's when you go over all the stuff. You know? So after this, let's say you do a crown the same day. So after this, you come back in 2 weeks to submit the crown, and you also have some filling on that side. I'll take care of you as well. Right. And there's two reasons for that. One, you give the patient some time to kind of digest the information, because they weren't expecting this, right? They thought they just come to get a cleaning. So now they're sitting up, they have time to think about it, ask questions, and it's a good way to save a lot of time. And plus, the patient can't say no anyway because the mouth's still open. So you can say whatever. All right, so if you come back, it's going to be 20,000, do a full mouth reconstruction, and then if you don't say anything right now, that means you agreed to it, so you committed. So we find it helps a lot, you know. And then by the time the patient walk out, then they got no questions.
Okay.
All right, so let's assign today. We get to do